Over the past several years, the Canadian Mental Health Association of Prince George and the RCMP have been working to improve their communication. This week, first responders worked on strategies to deal with people who have a mental health issue. They focused on how to act in a crisis.
There's a growing awareness of the role mental illness plays in conflicts that involve police. This week, RCMP members are learning how to connect with mental health services and learn more about people with mental illnesses.
We have a lot of different partners that the more we work together, the more efficient, kinder, gentler service we can provide, make it less of an impact on our mental health clients.
RCMP are frequently called out to mental health conflicts.
We do deal with mental health clients on a regular basis, and we do deal with some of the clients on a continued and almost chronic basis.
The ongoing partnership has been in place for several years. The goal is to help people with mental illness before they get into a crisis.
We are finding that the clientele that we deal with, we're hearing more good stories. We're hearing about how a member responded and talked to me, understood what I was going through. It's not always an apprehension leading to the hospital.
The first responder groups meet on an annual basis with Canadian Mental Health to examine and improve their response.
6 years ago, a lot of times it was pick up apprehension and sit at the hospital for 10 or 12 hours. And what we're trying to teach in this is that hospital is the last resort, not the first.
Canadian Mental Health feels there's still a lot of work that needs to be done.
One of our biggest problems is a lack of resources for our first responders after hours. We have the community response unit through Northern Health that's available 7 days a week, roughly 9 to 9:30, and can sometimes meet them at the hospital, give them some information over the telephone. But after that, we don't have those resources.
The hopes of this training session will also produce police officers who may become the first choice in responding to mental health crisis calls. Dave Branco, CKPG News.